So now we want to look at the classification of drugs that are actually used in the treatment of diabetes mellitus. And these drugs are the drugs that are known as oral hypoglycemic drug. Now I'm trying to actually define this. Okay, it just simply means oral. They are given through the oral route of what? Administration. Hypoglycemic just simply means a person has what? High levels of glucose, so you want to actually reduce the glucose. Okay, so they have hyperglycemia, you want to do hypoglycemia. So it's more of looking at the what classifications, what are the drugs that actually fall under this category. So oral hypoglycemic drugs, you should know that they are taken by mouth. Okay, and what is their use? Just to lower blood glucose levels. That's for diabetes. They are mainly used in type 2 diabetes. They work through different mechanisms such as increasing insulin secretion, improving insulin sensitivity, reducing glucose absorption, or promoting glucose excretion. So major classes of oral hypoglycemic drug, we have the Biguanides. So those ones, they decrease what hepatic glucose production, they increase insulin sensitivity, they reduce intestinal glucose absorption. Do you understand? So they will reduce the way glucose is in the system, but basically be putting it out. So they are the first line in type 2. Okay, so they can cause gastrointestinal issues and lactic acidosis. Then we have the sulfonylureas, which are the drugs known as things like the Glibenclamide and Gliclazide and Glimepiride. So they stimulate pancreatic beta cells to release insulin. So the more insulin you have in the body, the more glucose is being broken down. So they are very effective at lowering glucose levels. Okay, then we have the Meglitinides, drugs like the Repaglinide, the Gliclazide. They are short-acting insulin secretagogues. That means it stimulates insulin release, but that's mainly when the person eats. So they have a flexible dosing with meals. You can actually take them before you eat. Okay, used for post. Okay, of course, you take them before you eat. Then after you eat, they start functioning to reduce the glucose levels. All right. Then this is Glibenclamide. This is what Metformin. The next class of drugs, we have Thiazolidinediones. Examples of drugs under that class, we have the Pioglitazone, then we have the Gliclazide. So those ones, they improve insulin sensitivity in muscles. That means they will actually help that cells of the muscles are recognizing insulin more and are using it to actually break down glucose. So they have a durable glycemic control and actually improves lipid profile. The next, we have the Alpha-glucosidase inhibitors. So drugs like the Acarbose and the Meglitinides. So they delay carbohydrate absorption in the intestine. They reduce postprandial glucose spikes. That's after you eat, glucose levels tend to shoot up. These ones tend to reduce it. Alright. Then we have the DPP4 inhibitors. Okay, drugs like the Sitagliptin, Sitagliptin, Linagliptin. So they basically increase insulin release and they decrease glucagon secretion. Then we have the SGLT2 inhibitors. Drugs like the Canagliflozin, Dapagliflozin, Empagliflozin. They increase urinary glucose secretion by blocking renal glucose reabsorption. So once glucose gets into the renal route, it has to be put out. Do you understand? So you could say that they are almost acting like diuretics. This is Sitagliptin, right? This is Pioglitazone.